7. I hope this weekend block 1 wrap up finds everyone doing well. I'm going to do these after every block just to give you an idea of how things are going and kind of my insight so that all of you can hear it from one person. Again, just to kind of connect with everyone, if you will. So just first off, I'd like to say that I thought you all did a great job getting your stuff in on time, doing a solid job of answering the questions, and then and again, just getting it done on time. I get stragglers, and this group had no stragglers, and that was great. And I even had an opportunity to get started early because people had already posted prior to the Sunday midnight deadline. So again, nice work. So let's go into some of the other data in regards to the week, the block one information. Medical screening. So again, all patients, regardless of the method of PT access, it doesn't matter whether they're direct access or not, they all need to be appropriately screened. We need to be meeting these people where they're at. We need to be constantly evaluating them, and we need to be making sure that their current situation isn't changing. And sometimes people's current situation can change dramatically, and it's our ability to assess them, whether it's at their first visit or their last visit, and making sure that they're appropriate to be seen in our care. So whether they have scapular pain that could or could not be gallbladder, whether they have difficulty breathing, whether they have a rapid heart rate or high blood pressure, those are all things that we need to be cognizant of, because you have a higher risk of dying on a treadmill than being paralyzed by some kind of manipulation, and yet we spend a much more time focused on manipulation and the safety around it than we do of putting somebody on a treadmill and the effects that a treadmill can have in elevating their heart rate or their blood pressure. So be constantly monitoring, right? Allow people to tell their story. So a number of you I gave articles to make sure that you were that kind of captured that idea of an empathetic encounter, that therapeutic alliance, that making sure that allowing people to talk for 30, 35, 40 minutes if they have an hour to be able to give their whole story so that we're not missing some of those little idiosyncrasies that may lead into something bigger. Allowing them to talk and to give their story develops a greater sense of trust in you because they know you've heard them and that they have been listened to. So empathy, it's the heart and soul of any good, strong therapeutic alliance, and it boils down to just allowing people to tell their story. Outcome tools. Well, most people were using outcome tools. There was a few that weren't. They didn't feel like maybe in the setting that they were at that it was feasible. Quick Dash was something everybody seemed to be familiar with. People seem to understand the MCID and MCD, right? Minimal clinical important difference versus minimally detectable change, right? What the patient values versus what's statistical. And, even these numbers, I posted a Chad Cook presentation to some of you about the value of some of these numbers, and they still are a little bit called into question as far as if we can really rely on them. But I will tell you that it's important to measure change. It's important to see patients perform some form of outcome tool. And if the Quick Dash isn't effective, use the PSFS, the Patient-Specific Functional Scale. That is very much about what is directly related to the patient. It's very specific to their wants and needs. It can be measurable and certainly certainly something that can be adjusted. So I would encourage people to look at that. Yellow flags. So I'm throwing yellow flags in there because I think that they're really important. And, I mentioned in a couple of people's posts about the Wayner presentation, and I just think more and more emphasis is being placed in the literature on yellow flags. And whether it's tendinopathy, whether it's low back pain, whether it's car accidents, whether anxiety and depression are all important things to be screening for. And I really think it's not that big of a jump, or shouldn't be viewed as an awkward conversation, because all we have to say is, listen, we know that certain situations create a more painful experience. We know that certain diagnoses can create a more painful experience. We know that those two combined create a more painful experience. And then we can start to talk about and understand whether you want to call it TNE or pain science education. You start to open up that conversation that hurt doesn't equal harm, that not all pain is bad pain, that pain is an alarm system, right? All of these kind of more nuanced conversations about pain science education that's really important for people to understand about what their pain represents. And so I talk about this stuff all the time and help them understand that if their life's not going great, they're going to have a higher pain level. And if they have depression, they're going to have a higher pain level. If they have anxiety, they're going to have a higher pain level. And what pain levels really represent, and then how they can move forward from that. All right, next block, we're going to move into the shoulder. Talk even more in depth. That Hegedus article was really good, special test, and I kind of conversed with a few people on that, but we're going to go deeper. Just to let you know, I'll be sending out block 1 comments just about how we can perhaps be better. I think overall what we need to see in the responses is less good job, I agree with your post, and more of a dialogue, a more thoughtful dialogue, a more in-depth dialogue. Remember, we need to get our first response post in by Tuesday, second response post done by Thursday, and try to make sure that all of your original comments, or all your comments to your original post, are done by noon on Saturday. I know some people allow for later, and you can certainly engage after Saturday afternoon if you want to, but from letting people have their weekends and not worrying about this stuff and just putting a cap on it, I want it all done by Saturday at noon from a grading standpoint. So you need to have checked those boxes by Saturday at noon. Feel free to reach out to me if you have any questions. I miss things. I don't always see. I'm trying to peruse all of this stuff, but I miss things, and we're going to shift now. So I'm going to take Alpha Charlie Delta, and Trent is going to take Bravo. If you have any questions, give me a shout out. Otherwise, we're off to a good start. What I'll look for is just deeper engagement as we move on to the next 3 blocks. Bring literature into the posts. Talk a little bit more in depthly about one thing, right? Pick something that is challenging for you and move forward from there. Hope you all have a great rest of the weekend. I'm going to enjoy my watching basketball. Otherwise, we'll see you back in action on the threads soon.